This is the video for placing a Foley catheter in a female. You will need to check your chart that you have an order. In that order, it will identify the size, the type of catheter to be placed. You will also need to check your chart for allergies. Do they have an allergy to iodine, betadine, or shellfish? You will then obtain your kit from the supply closet, and you will check to make sure that the kit is intact, that there's no damage, no leakage, and then verify the expiration date. You will also have noted whether there is an order to obtain a specimen. Morning, Miss Grace. My name is Liz. I'm the nurse that's going to be taking care of you today. Your doc has asked for a Foley to be placed. Have you ever had a Foley? That is a rubber tube that we will insert into your bladder because the doc wants to keep a more accurate record of what your intake and output is. The catheter will stay in typically about 3 or 4 days, and that's when we take them out. Typically, there should not be any pain with it. It may be just a little discomfort when we're putting the catheter in. I noted on your chart you're not having any allergies. Are you allergic to iodine, betadine, or shellfish? Okay, we're going to get started then. I'm going to do hand hygiene. I'm going to verify my kit that it is intact and check my expiration date. I will provide privacy. If I do not have a privacy curtain, I will put a trash can or something against the door so that people do not enter the room while I am working with the patient. I am only going to expose the area that I am working with, and I pull the covers from the bottom of the bed up. That keeps them covered and keeps them warm. I will ask the client how well they can move or bend their legs. And if they are unable to move their limbs or they're rather large, I may ask another co-worker to come help me. You have these kits are a little bit bigger than the ones you have, but it's all the same that's there. You just grab by the top and open. I get a trash can and put beside my feet. You can do that, or you can use the bag as a trash receptacle. I also verify that the package is not soiled or damaged when I take it out. You can roll this bag down and make that your trash receptacle, but you're going to have it in a position that you can drop items in because you cannot touch the inside of that. These larger kits have pericare items. If you do not have this in your kit, then you can get warm soap and water to provide pericare. Studies have shown by doing pericare before you put your Foley in reduces the risk of getting infections in there. You put regular gloves on. And this little silver packet has 3 towelettes. I go ahead and open my towelettes so that I have them readily available to use. Because once I touch the patient, I don't need to let go to try to get my next towel. All right, I'm going to touch you and start washing. You spread the labia. You want to wash top to bottom, furthest side away. and throw it away. Again, this side next to me, top to bottom, and then down through the middle. Your kits, with some of them, they will show arrows that tells you what direction you're to lay your catheter tray. Your catheter tray, you want to lay, and you're going to open it furthest away from you, only touching the edge, because what's inside is sterile and you don't want to contaminate it. And if you have it flipping back, you do the best that you can. You want this bed up so that you're not leaning over, because that's going to wear on your back. So put the bed up to a comfortable position for you. And then I'm going to pull my last tab. You're going to ask your client to hold their leg and feet still because you don't want them juggling around. Your gloves will be in the middle. You grab, and you can either use the foot of your bed or their overbed table to put your sterile gloves on. Your dominant hand is what you're going to want to put on first, and you grab it by the cuff and lift it up so that you're not dragging across the paper. Get it on the best you can. If you don't get your fingers in the holes, that's okay. We'll do it later. The second glove you're going to grab by the cuff and the cuff only. You don't want this hand touching because that is all sterile. Hold your thumb up so that you don't hit your arm. You have a drape that you're going to lay things on. There's a shiny side and a plain side. Shiny side is going down on the bed. I take and cuff the drape across my fingers to protect me from touching the client. You get it as close to the perineum and drop it. If it needs to be moved more, you can. You can touch the center. You want to watch your hands to keep them above your waist. If you drop it below, you don't know if you've contaminated something. You have a perforated drape. I don't use that till the end. I use that to clean up. So I'm going to lay that to the side. You have betadine swabs. Some of the kits has the swabs in the package. Some of them just have the solution and you have to pour over the swabs. I'm not going to put the betadine on the swabs because it damages the mannequins. But once you pour it or you open it where that you've got your sticks loose, you reach and you drop it. If you're getting a urine specimen, you've got a cup. You want to set it where that it's not going to fall over. Lid up. And then you have two syringes. You have a water and a gel. The gel you put in your tray so that you can lubricate your Foley, and you drop it either in the trash or in your bag, either way. Some of the kits will come with what's called a stop cock. That is a device that attaches to the leg to hold the catheter in place. And this mannequin has one, so I'm not going to reuse it. Grab your catheter, pull the blue sheath off, and you want to hang on to the Foley so that it's not flopping, because when it comes out, you see it flops. If it touches anything, then it's contaminated. Attach your water. Lay your catheter in your gel. Once you have everything set up, Then you tell your patient you're going to touch them. Again, you spread the labia. Pick up one of your swabs. You're going to wipe from top to bottom, down, and come around. You don't want to go across your field because you can contaminate it and drop it. If you miss the bag or trash can, that's okay. You can pick it up later. The side nearest you, down. And then a third one down the middle. Once your one hand touches the skin, you cannot remove that. That hand has to stay there. You can move your tray up further. You want to lubricate about an inch. I have the patient take a deep breath and blow out. Take a deep breath and blow out. When they blow out the second time, I insert my catheter. That kind of helps get them, and if they'll keep taking a deep breath and blowing it out, it'll go in easier. If they hold their breath, that contracts and you're going to have trouble getting it in. Once you see you've got urine, you advance it about a half to an inch. Inflate your balloon gently. You don't want to inflate it too fast. It can cause bladder spasms. And you're going to have to hold pressure on this syringe because if you let go of it, the water's going to come back. Once you get all of the water in, take your other hand that's been against the patient, gently pull and see if that catheter's there. If it is secure, take your hand and undo your syringe. If you are obtaining a specimen, you would screw it here, pour your urine, hold it over the cup. You don't want to push it too fast because it will splatter, it'll cause it to tip over. I take and put the lid on so that I don't spill that urine. The catheter is then, you want a little bit of a loop in it and put it in your stopcock. You want a little bit of slack so that they can move. Take the bag, it hangs on the rail below the bladder. On the bed frame, you've got it secured on the bed frame, and then you just clean up. I take this one drape that I had and I can clean that betadine or extra gel off the patient. Put your patient back in a comfortable position. You're going to remove your gloves beforehand so that you're not getting all this gook all over the patient. And then take your specimen and clean up your mess. You're going to put the bed back down in lowest position. Make sure they've got their call light and their table is in place. Ask them if they need anything. And you want to tell your patient that they can be up and moving. They can walk, they go in the bathroom and shower, they can get up in a chair. That bag just has to be kept at their waist or below. Once you leave the room, you're going to perform hand hygiene. Exit your room. You will go to your chart and you will document the size and type of Foley placed, how the patient tolerated it. If there was urine return, you're going to describe that urine for color, odor, consistency. If you obtained a specimen to send to lab, you're going to document that also. And then make sure that you send that specimen to lab. Don't just set it down and forget it. You're going to have to label that specimen and get it downstairs. A few days have passed and the physician has placed an order to remove that Foley on Miss Crace. You will need to gather supplies, which is a 10 ml syringe, and go to your room. Hey, Miss Crace, I'm here to take that Foley out. We'll perform hand hygiene, regular gloves that's in the room, provide privacy if there's curtains. Again, if there's not, I put a chair or a trash can, something against that against that door, I'm sorry. Only expose the area that you're going to be working with. Check your Foley bag. If the bag has got urine, you're going to need to empty the urine. You want to raise your bed. Release it from your stopcock, and you can take alcohol and rub on this and it will peel off. It does stick pretty hard, and that's kind of a sensitive area, so be very gentle when you're removing it. You're going to deflate the balloon. You're going to have known by looking at your documentation how much water was put in there. You don't want to pull real hard because that's going to cause a suction type and it's going to cause bladder spasms. Once you have gotten all of the water out, I have the patient take a deep breath and blow out. Take a deep breath. When they blow out that second time, I grab the catheter and curl it in my hand. One smooth stroke and remove it. I grab my hand, cover the Foley so that it won't be flopping everywhere, and provide pericare for my patient. Your Foley bag is now, because it's had body fluids, is contaminated. It goes in a red bag and it goes into the red waste receptacles at each unit. You explain to the patient they may have a little bit of burning since that Foley is out, that the first time they get up to void, they need to call for assistance. You want to put a specimen pan, speci hat in their bathroom because you need to see how much they have voided. You're going to need to know how much they voided, the consistency of it, if there was any bleeding. There might be a little bit of blood in it, which is normal from the catheter being removed, but you don't want an excessive amount. You tell the client they need to void within 4 to 6 hours so that you are aware of it. Otherwise, we're going to have to see if they've got residual. That is extremely important when you're handing off report at shift change. Because if you took this Foley out at 5 o'clock, you go home at 7, the next nurse needs to know that by 9 o'clock this client needs to have voided. So that's very important. If you were to be transferred to another unit, you need to pass that on to whoever's taken over your patients. Or if that client is going to the ICU unit or going to the floor, you need to explain to them what time that Foley was taken out. You put everything back in place for the client, ask them if there's anything they need. You do hand hygiene and exit the room. You want to open the curtains and if there's curtains around the patient. When you get to your computer, you're going to document what Foley was DC'd and the consistency of the urine and the teaching that you've done for your patient.